the money as soon as the same business day.
Go to CashNetUSA.com to apply for the money you need.
Goodwill, changing lives through the power of work.
Valentine's is behind us, but it is still time in the month of February to focus on your heart health. This is the month that we pay even more close attention than we do during the rest of the year. So a fitting time for us to bring in two experts in the field, Scott Rowe, who is with Encompass Health, and Emily Fuller, who is with the American Heart Association. Good to see you both.
Good morning.
It was appropriate to bring you both together today because you're working together, Scott, on a regular basis with Encompass Health. It's a national organization with a local branch here in Chattanooga, but it makes sense to team up with a national group like the American Heart Association.
Yes, it has been kind of a natural partnership, and we have worked together for many years on a local level and just recently on a national level, as Encompass Health is a national sponsor of the American Heart Association.
So we recently observed, if you will, Go Red for Women back, what was that, the 5th of February, Emily?
Yes, it sure was.
Looked a little different this year, but the American Heart Association obviously passionate about heart health for everyone, but for women there is a special focus. Why?
Well, heart disease remains the #1 killer of women, and in fact it kills 1 in 3 each year. So we're trying to call sort of the extra level of awareness, especially in current times.
So can you elaborate a little bit? I should know these warning signs and statistics like I know my own name and social security number, because my father died of a heart attack when he was in his early 50s. Heart disease ran in his family. My brothers and I have always been very watchful, but I probably don't pay enough attention, Emily, to what my symptoms might be. Does that make me pretty typical?
Absolutely, and that's really where Go Red for Women was born. You know, we realized that women didn't recognize that their symptoms for heart disease and stroke were different than men's, and so we started to make a concerted effort to educate first, right? So it's not the typical Hollywood heart attack that you might see in a movie. Women sometimes will mistake their symptoms for, just being exhausted, right? We do a lot. And so sometimes we might think we have indigestion, or that we're tired, or maybe a little depressed or have anxiety, when in reality, we have to pay attention to our bodies and advocate for ourselves. Because, it may be that you are having heart attack symptoms and you just set them to the side, and we would much rather, have women go to the emergency room just to make sure.
So, okay, if you're going to talk about going to the emergency room, Scott, I'll let you jump in here if you want, but if it's appropriate to punt it back to Emily, that's fine. But here we are living in this COVID world for the last year. Did that deter a lot of women and men from getting the help that they needed?
Yes, I think we did actually see that in the last year, and it's kind of frightening, whether it was signs of a heart attack or signs of a stroke, that folks, unfortunately, in the community were afraid to seek needed medical care because of the fear of COVID. And we saw in a local area, and especially even with our hospital, a drop in numbers related to these diagnoses, and some of that is just that fear of COVID, which is unfortunate, because it is just as critical, if not more so, to seek care if you have signs of a heart attack or of a stroke.
What you're able to do at Encompass, and I may have this wrong, so you're free to correct me on the air, but you can have a heart attack or a heart concern, go into the hospital, and you can be released to go back home. But often there is a rehab period of time that you have to go through. Is that where Encompass steps in?
Exactly. People traditionally think of inpatient rehab for people recovering from stroke or brain injury or maybe a major multiple trauma. But we also have quite a few patients that are here recovering from open heart surgery, from bouts of congestive heart failure and other forms of heart disease. And so we're able to help those patients in regaining their strength, continuing to regain their medical stability after recovering from these situations. We provide a hospital level of care, and particularly with patients who are recovering from a heart condition, it's important to have that hospital level of care where they have the availability of a physician every day, where, for example, in our hospital, we can provide telemetry monitoring just as would be done in a hospital setting, respiratory therapy care that's so important for these patients. And that's in addition to just what you would traditionally expect to see in an inpatient rehab hospital, which is therapy provided by physical therapy and occupational therapists and speech therapists to regain strength and regain independence and then return home.
But it's done on a more almost aggressive level, if you will, right? I mean, this is not a time to just sit back and heal. The healing process is very active at Encompass.
You're exactly right. And I think sometimes there are some people who get a little bit intimidated by hearing of an intense level of therapy. But we do provide the most amount of therapy in any setting. But it is also individualized. It's tailored to what that patient can tolerate. And so we do sometimes see patients that start their stay at a pretty fragile level. We have to progress kind of slowly to start with and then gradually build up to what they can tolerate. So it's definitely individually based as far as the development of their treatment plan.
I'm sure you're getting questions on a pretty regular basis, and I'll speak on the Encompass side, then Emily, we can go to you with the AHA. But on the Encompass side, when someone does transition over to you, what is the family doing in terms of access right now with COVID?
Well, for our particular hospital right now, we still have restrictions in place for visitation. That is something that we have modified as we've gone through the pandemic. We were able to open it up for a while before the holidays, but then chose to restrict visitation as the numbers in our community were on the rise. This is a very vulnerable population we have here, and so we want to make sure first and foremost that we're protecting them. That being said, we've been creative. We're fortunate that we have all of our patient rooms on the first floor, so all rooms have a large window in them, and so that's made it convenient for our patients to still be able to visit face to face and still see their loved ones and interact in that way.
That's very nice. So Emily, can I ask you this too? I mentioned my father and his heart disease and how my brothers and I have been careful, but I've been now taught that to a degree to my daughters. Do you find that young people need to be aware of these heart symptoms as well? Because doesn't it strike at younger and younger ages these days?
Absolutely. At the end of the day, we want everyone to be aware of the signs and symptoms, and the earlier we can arm people with the information they need, the more educated they can become. And we really encourage people to understand their family history. And, as we hear Scott talk about, it being encouraging people to listen to themselves, to their bodies and to go seek care. That's another thing. We've been supporting our inpatient and outpatient clinical partners to say, don't die of doubt. If you see, heart attack symptoms or you suspect that you might be having a stroke, we really are encouraging people to go to rehab if you're scheduled to be there. Go to the ER if you suggest that if you think you might be having heart attack symptoms, they are prepared for you. And so really, I think that's the name of the game, right? Is making sure people are prepared, educated, they understand their risks, and they know what to do. And right now, even amidst COVID, that there are protocols in place and they should feel confident and safe to put their health and safety first.
And if you wanted to be CPR certified, are those classes still going on?
Absolutely. We still work with our partners to make sure that if you'd like to be CPR certified, there is some digital options as well. And we've been doing quite a bit of hands-only demonstrations in the digital space just to arm people temporarily and to help them understand that you can still conduct effective CPR with just your hands and compressions during this time.
Well, it is great to spend some time with you remotely. But Scott, if people are watching you this morning and they're thinking, okay, I think I'd like to try Encompass for my loved one or for myself, do they self-refer to you or does the doctor have to send them your way?
We can work through kind of both routes. They can self-refer. We're going to follow up with their primary care physician if that is the case. If somebody is in an acute care setting, it's just important that they discuss that with their case manager as they're looking at their discharge plans. and ask to speak to a representative from Encompass Health.
All right, well, here is the information. Good to see you both. Enjoy this rainy day.
Yes, thank you for having me.
Thank you.
Encompass Health on Macaulay Avenue. Their phone number is 698-0221. You can also find them online, encompasshealth.com. We're back after this.
How is yours? Because you got the spicy cheesesteak.
A little.